is short bowel syndrome? What is intestinal failure? Is it a new disease?
Short bowel syndrome, intestinal failure, is not a new disease. It's been around for many, many years. It's rare. It can be quite harrowing. What it involves is losing the ability to use your gut. So eating doesn't work for adequate nutrition. You need to give food, nutrition, via another route. And the other route is into the veins, so intravenously. Patients who have short bowel syndrome, who can't use their gut for a variety of different reasons, they've lost gut, have feeding lines in their neck. And the feed goes into that, and that's potentially a lifelong condition.
What are the common themes affecting the condition?
SBS-IF affects patients in very different ways, depending on where they are in their lives. But the common themes are, I suppose, the way HBN, the need for HBN, the need to be hooked up to a bag 12 to 14 hours a night, restricts patients' lives. Complications, being readmitted to hospital, worries about complications affects patients' lives. But one of the other theme that's forgotten is the underlying disease, and that does have an impact on patients.
Can you tell me more about the lifespan of the people with this condition compared to people without this condition?
We know that people are at risk from complications from the treatment, but if managed well, those complications can be minimized. And people, on balance, don't actually die from complications related to the feeding. People die from the underlying condition. So overall, if the complications are well managed by good team working, people can have normal lifespans.
Which diseases lead to intestinal failure?
People need intravenous feeding for a variety of different reasons, and it actually varies between countries. So in places like England, we know Crohn's disease has historically always been the main cause. That may have changed recently, and complications related to surgery lead to the need for intravenous feeding. Whereas in France, we know that lack of blood supply to the gut is the main reason why people need long-term intravenous feeding. In other countries, Germany, Italy, it's actually cancers that lead to the need for intravenous feeding.
What defines good quality care?
The most important aspect of good quality care is putting the patient at the centre of a wide, multidisciplinary team. And patients like to have ready access to different members of the team. It is important to meet patients' needs through a wide team with different expertise. So it's important to have dietitians, nurses, psychologists, surgeons, physicians like us, biochemists, pharmacists.
How is care provided to these patients throughout Europe?
The care of patients with short bowel syndrome who need intravenous feeding does vary. We know that because the reported prevalence, the occurrence in different countries, seems to vary a lot between different places in Europe. In one country, it may occur in maybe 5 per million patients. In the other extreme, we know a country delivers care to 80 per million patients, and that's a big difference. So we know there must be significant variation in either how it's reported or how people with the underlying problem are treated.